In this video, we will continue to look at diseases of undernutrition, and in particular, osteoporosis and diverticular disease. Osteoporosis is generally a condition of older people, although some people in their middle age can start to develop signs of osteoporosis. In osteoporosis, bones become porous and fragile due to loss of calcium and other minerals from the bone matrix. This is illustrated in the diagram, where figure A shows normal bone density in a healthy individual, whereas figure B shows a porous bone matrix, porous meaning filled with many little pores or holes where calcium and other minerals has been eroded away from the bones, weakening the structure. Peak bone mass is achieved for most people by their late 20s. In the graph shown, you can see that peak bone mass is different for males and females. Females never reach the same peak bone mass as males. However, for both males and females, peak bone mass can be seen to be achieved in the late 20s up until the 30s, from which point it declines for the rest of our lifetime. For males, this involves a steady decline from the peak bone mass achieved in the late 20s, whereas for females you can see that the decline is much steeper around the ages of between 50 and 60 years. This corresponds with the years of menopause for women, at which point bone loss is accelerated due to the hormonal changes involved in menopause. For this reason, women have a much lower bone mass as they hit old age than men and are much more at risk of osteoporosis. This leads into a discussion of the risk factors for osteoporosis. The first one being age. Early childhood and adolescence are considered bone acquiring years. Low calcium intake during this time limits the bone's ability to achieve an optimal mass density by the time we reach the peak bone mass in our late 20s. Late adulthood, on the other hand, comprises the bone loss years. This is shown in the image at right, with a woman of approximately 35 years having still, most likely, a peak bone mass. As the years progress, however, her bone mass decreases with the onset of menopause and old age, and you can see that she becomes shorter and more stooped in her stature as her bones lose the structure they once had. Low body mass index is another risk factor for osteoporosis. Underweight people tend to lose bone and muscle strength and are more at risk as they age than people of a normal body mass index or even a high body mass index. Gender is another risk factor. As previously mentioned, men have greater bone density than women to start with, and women lose bone density in the 6 to 8 years following menopause. Physical inactivity is another risk factor, as weight-bearing exercise actually promotes bone strength. Weight-bearing exercise includes resistance training, but also something as simple as walking, where the weight is being put through the bones to encourage optimal bone density. Other risk factors for osteoporosis include alcohol consumption, as alcohol enhances the rate at which fluid leaves our body, which can actually lead to accelerated calcium losses in the urine. Similarly, high sodium, protein, and caffeine intake reduce calcium absorption and also enhance the rate at which it is excreted in a similar way to alcohol. And finally, smoking leads to bone degeneration and a greater risk of spinal injuries for smokers. With osteoporosis, prevention is better than a cure. As peak bone mass is achieved in the early to late 20s, it is critical to maintain a diet rich in calcium, vitamin D, C and A during childhood and adolescence. This is generally easy to achieve if you are someone who consumes dairy products such as milk, yogurt and cheese. However, for people who follow a dairy-free diet, fortified dairy substitutes such as almond and soy milk are encouraged. It's important that these are actually fortified with calcium to ensure that they're providing an equivalent amount to what their dairy substitutes would. Additionally, Tofu, leafy greens, orange juice, legumes, and nuts are some other non-dairy sources of calcium. It's also important to note that vitamin D and phosphorus assist in the absorption of calcium and therefore the normal growth of bones and teeth. These should also be included in the diet. However, vitamin D deficiency in the diet and phosphorus deficiency are much less likely in Australia than calcium deficiency. We'll now talk about diverticular disease, our final disease of undernutrition. Diverticular disease results from constipation, which is characterised by the inability to pass soft stools regularly. Many people in Western countries are constipated, in fact. However, most assume that their infrequent bowel motions are normal. In diverticular disease, water is removed from feces in the large intestine. This is normal. However, extended contact with the intestinal walls dries out the stool and causes irritation or inflammation of the bowel wall. Pressure causes the bowel walls to rupture, forming a pouch or diverticula, where small stools can sit. Diverticulitis occurs when these pouches become infected. The image at the top right is an actual photo taken inside the large bowel, or the colon, where small pouches of infected feces or stools are sitting. This is further illustrated in the diagram at the bottom, where you can see little pouches in the walls of the colon which have developed. Risk factors for diverticular disease include inadequate fibre levels. This is because insoluble fibre adds bulk to feces and speeds up the passage through the large intestine. Insufficient levels of fibre mean that food stays for too long in the colon and is not expelled at the correct rate, allowing it to sit around and become infected. A lack of physical activity is another risk factor. Physical exercise improves not only the muscle tone of our external visible muscles, but also the muscles of the gastrointestinal tract. And this is important to allow peristalsis to occur, to allow food to move through the respective organs of the gastrointestinal tract, to allow digestion to be as efficient and timely as possible. The third risk factor is inadequate fluid or water intake. Dry fecal matter is harder, more difficult to pass, and more likely to lead to irritation of the bowel wall and then infection. If this does occur, the kinds of symptoms that can happen include abdominal cramps, bloating, painful bowel movements, tenderness or pain in the left abdomen, which is the last part of the colon, bleeding when passing stools, diarrhea, vomiting, fever, and chills, and even nausea. To overcome diverticular disease, it's important to not make dramatic changes, but to gradually add fibre to the diet to allow food to pass through more regularly. Additionally, whenever there's an increase of fibre in your diet, it's important to drink extra fluid to counteract the effect of the fibre. But in any case, additional fluid in the diet is important for diverticular disease. Eating regular meals can help with making digestion more efficient, as does exercising daily to keep those muscles toned. Treating constipation with laxatives should be avoided, as laxatives upset the body's fluid, salt, and mineral balances and can actually cause rebound constipation as the body becomes dependent on laxatives for regular bowel movement.